Hi, everybody. Thanks so much for joining us again this evening. I am thrilled and honored to have Dr. Asaf Bitton with us this evening, a practicing primary care physician here at Brigham and Women's Hospital, and one of the foremost experts on coronavirus that I think you will find. His early paper about the importance of social distancing, or as he calls it, physical distancing, to emphasize the fact that we still need that social connection, but that those physical distances that we need to put between us are at this point probably the best thing we can do to, as you've heard so much, flatten that curve and make sure we are able to get through this crisis. So he's going to join us and talk about what he's seeing as a medical professional and also as a policy and public health expert around what life is like for him, how life has changed, and what we need to get through, what we need to do to get through this crisis. But before we hear from him, I wanted to acknowledge the fact that this is going to be a very difficult week for thousands, if not millions, of families across this country. We heard that the administration finally acknowledged that this is a very, very serious crisis, and that for so many families, this week and next is going to be one it peaks. So we've had here, even in Boston, yesterday, might have been this morning, our mayor came out and said that there was going to be an evening curfew put in place, and that policymakers are pushing everybody to do everything they possibly can not to go out in public. One of the experts in Washington who said, unless you absolutely need to, don't go to a pharmacy this week. Don't go to the grocery store. Make sure you're stocked up, and then shelter down and make sure we can get through this. There's going to be an awful lot of people that are whose loved ones are very sick, and there's going to be perhaps tens of thousands of Americans that pass away this week, according to projections. I ask that everybody this week, understanding that, do everything they can, one, to abide by those recommendations, and two, to reach out to each other, check in on somebody. Whatever they can do, whatever we can do to help our neighbors and our friends and our family members through this, we all need to try. And grateful for all of the efforts that we're reading about and seeing about from so many people across this country as every person tries to step up and do their part. But please keep that in mind, particularly over the course of the trying days and the weeks to come. And with that, to try to bring some greater detail and articulate a bit more about what we can expect over the course of the days to come, here's Asaf.
You look healthy and well, so first off, I'm grateful for that. And how are you?
Well, thanks, Joe. I'm doing okay. I mean, this is a crazy time, but yeah, we're hanging in there. There's
Good.
really a spirit of everyone to the ramparts right now in healthcare.
And so talk to me a little bit just about how your daily routine has changed and what you're seeing as a medical professional on the front lines.
Primary care physician. So I live in the ambulatory or outpatient realm. I'm part of the Brigham. My practice is in Jamaica Plain. It's been incredible. Within, I would say, 2.5 weeks, we have flipped the model of healthcare in primary care and in other specialties. Within 2.5 weeks, we have 90% or more of our visits are now like we are, on Zoom or on Skype or on the telephone. Even for people for whom technology is not easy. We've flipped the script here. What couldn't be done around making healthcare more accessible and not waiting in the waiting room for half an hour, et cetera, happened, I don't want to say overnight, but basically in a week. We've regionalized the way that we do primary care. Half the clinics are closed right now. The other half, like mine, are centers for basically a combination of really urgent things that we try to offload from the ER and doing virtual visits and telephone visits and checking up on our most vulnerable patients.
And that's some of that better? Like,
yeah.
Is some of this, I assume, this model, what has always been built on our healthcare system, has been built on a doctor-patient relationship, right? So you don't feel well, go in, get an appointment, get checked out, get some medicine or some intervention, and you go home and get better. Are there some aspects of this that you think that the impact of telemedicine and the ability to actually engage in this without having to go sit in a waiting room for a long time, that I assume there's efficiency there for you and your practices? Are parts of this that you think we should keep going forward?
There's a huge silver lining here. Those of us like me and many others that have been on the forefront of modern team-based models of integrated care and telehealth, we've been needing, quite frankly, an impetus, a moment like this to sort of flip the model. Part of the model is based on an old idiosyncratic way of paying doctors and nurses that doesn't make a ton of sense, quite frankly. But part of this is now that we realize, and our patients are realizing, that they can get the same relationship-based care on the phone or on the video visit, and it works better for everyone. So I think I cannot imagine that the way that you access and get primary care is going to be the same a year from now, even after this COVID-19 crisis.
And tell me a little bit then, because you talked a little bit about how your practice, a lot of these offices are shut down. Your practice is basically trying to alleviate some of the structures or some of the patients that are coming to an ER. Are you seeing a lot of folks that you suspect have COVID-19, or are you seeing a lot of patients that don't? And then walk us through kind of what you expect the healthcare world is going to look like in the next 10 days, 2 weeks here in Massachusetts.
Yeah. Depends on how you use the word seeing. We're actually trying not to see physically people with mild symptoms. So most of our days, most of our calls right now, Joe, are actually about COVID-19. I mean, it's that rampant. You see the numbers in the globe, but you see, I mean, we feel them. I live near the hospitals, and the sirens are going off day and night with ambulances bringing people into the hospital. So what it means for primary care is that we're getting a ton of calls. We are triaging all the time. If you're sick, we send you to the ER. If you're somewhere in between and we need a rapid diagnostic test, we send you to basically what's called a respiratory illness center, which we've flipped some of our practices into. They're not ERs, but they're not normal primary care practices. Everyone's got protective equipment, and we're doing what needs to be done. And it's a second triage to either the ER or home with close monitoring. And then the third kind of practice is like ours, where we're dealing with everything else, because healthcare and health doesn't stop, and people come in with everything else, and they have appendicitis and everything. So we need to be able, the true measure of the resilience of a healthcare system is not just how you respond to the crisis coming in, and not just how you bounce back better, but it's actually how you take care of everything else that's not the crisis, and whether you take care of everything else. So, I mean, we're really lucky in Eastern Massachusetts, and we're really lucky to have had a wonderful response across the Boston hospitals. That, unfortunately, is not happening everywhere in the US.
So walk me through a couple of things. I think it was today where the governor actually put out that they expect that surge to come in, I think he said, a state writ large. And two, what does this mean for the Berkshires? What does this mean for the South Coast? What does this mean for places that don't have the massive concentration of academic medical centers that Boston does? But also, at least from my conversations with a number of those healthcare experts, the Berkshires, other parts of the state, are a couple weeks behind where Boston is, right? They're not seeing the same contemporaneous movement here, but so Boston might be leading that, but they've also got more resources here. So kind of, if you have some thoughts on as to what that means, walk me through it.
Yeah, so the best modeling that I've seen, and in our discussions with local and state leaders, everybody's pretty keyed in to this real surge coming sometime next week. We are all battening down the hatches across all the health systems, Boston, not Boston, everywhere in Massachusetts. The peak is thought to be around April 15th. What that means is even higher levels and even higher volumes of really sick people. So practically speaking, that means that for instance, at the Brigham, we have plans, and then plans beyond plans, to basically, if necessary, we will, bring in our physicians from the primary care realm. We will bring everybody necessary into the hospital we'll flip whole other sections of the hospitals into COVID wards already. You know, a big part of the Brigham can be flipped into basically a massive multi-hundred bed ICU. They've found the vents, you know, they're ready to go, but we will need even more people. And so there's a staffing plan for that.
Do you think there's sufficient ventilators?
We think we have sufficient ventilators, I mean, according to the modeling. But I will say that, you know, anyone who doesn't fear and respect COVID-19 is silly. You know, we have to be prepared to, and we are doing our best to for that day when we might not have sufficient. And you know, it's been a public-private effort. You know, they're building out the Boston Convention Center and also the Convention Center, I believe in Worcester or somewhere in Central Mass, to be those overflow hospitals. We have to act as if the first surge and the second surge won't overwhelm us. And then there's PPE, of course, you know, protective equipment. A huge breakthrough today that you know, you probably heard about, which is really going to be a game changer. This new Battelle system in Somerville that will by next week have the capacity to basically safely wash up to 80,000 of the N95, the really specialized high filtration respirators that you need during a procedure or during high infections times. You know, that's going to really, really help the PPE situation, which, and otherwise we might get really stretched with that.
And so what does this mean for if you're down on the Cape, if you're in the South Coast, Fall River, if you're out in the Berkshires, you know, there's 5 academic medical or 5 level 1 trauma centers in about a half-mile radius in Boston. I don't think there's a concentration like that anywhere else in the country, perhaps in the world. What does that look like if you're in the Merrimack Valley and you say, hey, there's a greater surge in Boston, but you also got the resources there. What does this mean for our regional hospitals? And how do we kind of take that part through?
Couple ways to look at this. I mean, the first way to look at this is that I really think that the state response has been strong and coordinated. So it's not as if this is all about Boston or the other parts of Massachusetts are going to be left behind. We happen to be hit, as you said, hardest right now with the surge in cases. We're hoping that if we can manage that initial surge, let's say at the end of next week, and get past it, that the resources, the staffing patterns, the protocols that we're building, there's no dominion over them. We're going to share. We're going to, you know, that facility in Somerville that they built, that partners built, is going to be a statewide facility for cleaning and reusing masks. That's going to be a game changer, whether you're in, you know, in the Berkshires or on Nantucket, because we all have that same crunch. I also wonder, though I don't know exact plans, but, you know, if we can withstand the surge, you know, and get the equipment through, there's no reason that, you know, in 3 weeks there's a surge in Western Mass, you deploy the ventilators there, because the federal stockpile, it's not like the cavalry isn't coming. This is right now a state by state battle. Luckily, we have a unified state response, but, you know, there isn't a federal sort of, the federal cavalry are not coming in terms of PPE or ventilators.
So walk me through that a little bit here. And again, you were one of the first folks that I saw out there writing about the need for physical distancing. This job has been an extraordinary honor for me. Never in a million years would I have thought that part of my job description would have been trying to connect health centers, hospitals, hospital executives, hospital associations, people writ large, with manufacturers in Central Asia and China and other places, trying to figure out how you get firefighters, trying to figure out how you get masks, suits, face shields, hazmat suits. And literally, it's like hours of my day trying to figure this out. Because in part, that federal response was so lacking. So as somebody that knows this stuff and saw this coming to an extent, saw I think the impact of a government that didn't go aggressively enough on the social distancing early, the physical distancing early. What does this mean across the country, and how would you characterize that federal response, and what do we need to do differently, aside from everything?
Yeah, well, you know, I'll make a few comments about this now, and then also bracket this by the hope and the intention that there should be a set, and I really trust and hope in you and other like-minded leaders to, at the right time, really lead a set of truth-telling commissions about the story, and about the story of how, when you ignore inconvenient facts and science as an administration, and when you systematically defund and under-prioritize crucial public health functions and responsibilities, and politicize those functions, it's not a game, it's not politics, it's not something that you win the day's headlines with. It has deadly consequences. I know you and many of your colleagues sounded the alarm. But at that time, you know, when you have, quite frankly, and again, I don't want to politicize it, but we can't hide behind the facts. When you have an administration that literally dismantles the Office of Global Health Preparedness, I'm sorry, but as a physician and public health professional, I can't quite square that with being able to mount a unified federal response. And when you ignore clear science, math, and numbers about what is happening, and when you, on the same day that, you know, South Korea has its first case, we had our first case, they had a unified, coordinated, scientifically based response. They have 9,976 cases today, and we in the US, as of right now, have 243,970 cases. You know, the lack of that preparation, the lack of basically keeping the national emergency stockpile funded, the lack of making available and even just implementing the contracts around building emergency ventilators that were funded and appropriated by Congress years ago, it's hard not to feel strong emotions, Joe. And it's not anger at any one person. It's just, we have a responsibility as a country to learn and deeply examine our lack of a relationship with planning ahead and investing in the right public health functions that we need at times of crisis like this.
So I wholeheartedly agree. I think one of the points that I've tried to make in this, again, without Monday morning quarterbacking it too much, because we are in the midst of this, and let me be clear, I think, I don't want to speak for you, but I think we would agree on this. I'm rooting for Trump administration here to succeed, right? Their success will mean an awful lot of people do not get sick and die, right? So right. However we can be, and I can be helpful and supportive if we want to be. The reality of the kind of ignoring some of those facts and being slow to act, I think is has had tragic consequences. What we've also seen is, given the fact we are a big country, far bigger than South Korea, you have seen regional variation here, right? Yeah. Started in Seattle, we've seen, for some, I think people are trying to figure this out. You perhaps can enlighten me a bit. We haven't seen this take off in California the way that some of us might have thought. California has an awful lot of direct flights to China. It's got large Chinese communities in San Francisco and LA, and plenty of communities in between. And deep ties there. One would expect that if you're going to have that outbreak in Seattle, if it was coming from China, you certainly would have had it in parts of California. We haven't seen the great exposure there that we've seen in New York or even in Boston. But there's parts of the country now that don't have major outbreaks. They've got some cases. Part of that, obviously, again, with regards to testing and a lack of sufficient testing. But I think it is fair to say there's parts of the Midwest and rural America that aren't affected with this as New York is or Boston is. But still a lack of an appreciation that if you do not engage in some of these preventative measures, it is going to get there. And I guess, how confident are you that if we do not actually all kind of buckle in for a significant period of discomfort here, that pain is going to go on for a longer period of time and be far more disruptive? Is there a way we can, parts of the country will kind of skate through this relatively unscathed, or are we, if you ignore it, we all kind of do so at our peril?
Well, I think that, you know, the experience of every country so far has been that you ignore it at your peril, that you believe that you can contain it and sort of bury your head in the sand at your deep peril. You know, this virus just simply has an infectivity rate and a boundarylessness that's been quite incredible. It doesn't care whether, you know, the population doesn't take it seriously or not. It moves stealthily because of its asymptomatic window of transmission of 5 days. It moves exactly when you don't expect it to move. So your you know, a person, state can feel like they're doing fine, but they really have, without broad-based testing, they really have no idea. Now, I think that the bright spots of Seattle, the Bay Area, have really shown that effective physical distancing, it can not just flatten the curve, it can smash the curve. I mean, San Francisco is doing an amazing job right now. You know, they shut down about a week before Massachusetts did, and I think we're seeing the clear dividends. Now, what's happened in New York is complex and has a lot to do with, you know, deep, dense urban populations, a lot with inequity. We know that this disease, like every other disease, feeds off of inequity, feeds off of poverty, crowded housing, things like that. So we have to understand that. But, you know, I think what makes this crisis so difficult is that it keys in to what's really difficult for people, all humans, to really understand, which is two things. It's hard to prove a negative, and it's hard to think in nonlinear terms. So what do I mean by that? So I live in the world of primary care when I'm not in public health. We're always about prevention. We're preventing things that if we're successful, you'll never see me. You'll never think about. It's not going to be top of mind. So what's the win? It's hard to see the win. It's hard to take your medicine for your cholesterol and to get your cancer screening, because if we're successful, nothing happens.
Welcome to my world, right?
Right. The second part is nonlinear thinking, which is it's hard for people to think in exponential terms, and viruses replicate in exponential terms. So if I tell you this thing is going to be 10 times bigger in 3 weeks, you can get your head around that. Most people can't. But if I tell you it's going to exponentiate to a third or fourth power, that's not just a math thing that we've all learned about in 8th grade. It's actually really hard to see what's happening in that rapid rise of rate, except at the tail end when you're like, oh my goodness, we just had like 10,000 cases and a week ago it was 100. How did that happen? That's exponential numbers, and that's what viruses do. And they catch us off guard. It's almost like this virus is a laser-guided munition onto the faults of our health system, its fragmentation, its lack of coordination with public health, and its inability to see numbers like this.
So could not agree with you more. And I think even more so than just our health system, what this virus is doing a little bit of where we started this conversation, showing the faults and fractures of our society, right? Not just the inequities in the health system, but of paid leave, right?
Yeah, exactly.
If somebody gets sick, dear God, one, this proves the fact that your healthcare and my healthcare are linked, right? And that if you want people to get better, you need to make sure that they're not forced to choose between their financial stability and their physical health, right? Inequities around a gig economy and a contractor is trying to make sure that they have the ability to actually stay home and get well. Issues around not just cost of a test, but cost of treatment.
Yes.
You know this better than I do. I have been surprised at the fact that it appears to me anyway that people that are in need of a ventilator for this virus stay on it for a pretty long period of time. They're on it for, I've got one friend whose daughter has been on one for 2 weeks. But from what I've heard from a lot of doctors is that it's about a week on a vent. It's not 2 or 3 days. It's not a shorter duration. But that bill at the end, again, you would know better than I, but if you're in an ICU for a week on a ventilator, that's going to be in the hundreds of thousands of dollars.
Easily.
You're just bankrupting every family if you don't have insurance.
Yeah.
And it's a pandemic. A lot of people are going to get sick, right?
Yeah. By definition.
By definition.
Yeah.
Right? And so we have some, I don't want to call this a silver lining because it's come with such pain and despair and devastation, but it is actually proving that negative. It is proving hey, this isn't a hypothetical. This is if you strip out the fire hydrants because you say, hey, we never use them and there's no point and it just costs some money, so there's a way to scrimp on this and save. Well, that's fine, but now you're proving the negative of what happens if you actually don't have them, right? What happens if you don't actually go through that additional mechanism? And so I do hope it's giving us, because I mean, what would have been next to impossible 2 months ago to try to get Congress to appropriate $500 million to do anything, we just did 2.2 trillion.
Yeah.
And there's more coming, right? 500 million is literally a rounding error.
Yeah.
In number. So I think hopefully we do learn this lesson. What is something that you've, given what you've seen and the stakes that are ahead of us, what's something that brings you optimism, or what's something that gives you hope about this?
There's a lot that gives me hope. And, you wake up every day thinking about the fact that in the same way we felt and we saw 9/11, you saw first responders running by the thousands into burning buildings. It's not too far of a stretch to tell you that that's what's happening multiplied by millions on a daily basis in the US right now. You literally have millions of, and it's not just doctors, it's not just nurses, it's janitors, food safety workers, grocery store clerks, delivery people, everybody engaged in all of the essential services that we sometimes forget are essential, are running into the fire. They're putting their lives on the line, and not in a melodramatic and with the string music going on in the background. They're getting up before dark, putting their work clothes on, putting their masks on if they're in the hospital, knowing that it's gonna stink it's gonna be a hard day, and knowing that they're gonna do it tomorrow and the next day and the next day, because it's what's necessary. And I haven't seen people shirk that duty. My grandfather was in World War II. He fought in the Battle of the Bulge. He was a tankist. We talk a lot about, and when he was alive, I talked to him a lot about this idea of the greatest generation. And you always wonder, how would we measure up? How would we measure up as a generation when it came time for us to meet the call that is necessary? And there's so much written about Gen X and Gen Y and millennials and everybody else, and we're all supposedly kind of, lackadaisical whatevers. I haven't seen that. I haven't seen Massachusetts graduated 700 medical students early because they wanted to go to the front lines. They wanted to go and be interns and basically help save their fellow Massachusetts residents. And that happens over and over. So that gives me enormous optimism that we can actually have a conversation about what it's necessary, because we're all in this together, and that in some way this almost forms a new social compact. That's my hope.
There you go. I wanted to close with this. If you had concrete advice to give people to make sure that, given what you just said, and I've actually I've seen it from the folks that are writing in, that post comments to these pages, the calls that we get, the calls that I'm on, people also feel a little bit helpless because they see others bearing this enormous burden and they want to help, yet they don't exactly know how to help, because we got to keep this distance, and there's an awful lot of challenges we're seeing economically and physically and everywhere else, as you know. But if you had, as a doctor, as a public health professional, if you had advice to give somebody to make sure that everybody did their part, what would that be?
The first thing is the basic and crucial thing right now, and we'll say it now, and we'll say it in 2 weeks, and we'll say it in 4 weeks. People have to have the stamina to practice the physical distancing. I know people want to go see their friends. They want to hang out. They want to have the block parties and only be 6 feet away. But we're all in this together, and we've really got to maintain that stamina for a few more weeks. This surge will pass, and it'll pass faster, and we'll get back to work if people can practice that stamina. The second piece is really around, the best way to help, besides staying at home if you can, is to think around you. Who in your sphere works at that restaurant that you love, but now you can't go to, and it's a mom and pop restaurant? Can you support them in a different way? Can you call them and buy a gift certificate? Can you, everyone's launching GoFundMe pages. Can you support the elder community resource that delivers meals and key services to vulnerable elderly? Can you support the people that are in shelters? There's so much opportunity to financially and just physically, in terms of phone calls and other methods of support, just connect with others without actually touching them. And the third thing, as I say, as a primary care doctor, is don't worry alone. Don't worry alone, because you got to reach out. This is a time that's so crazy and unprecedented that even if, you feel like you're fine or you feel like you have to hold it all in, we all have those moments when we need to reach out. We don't have to be tough guys and tough gals. We are human, connected, socially connected creatures. We need that level of outreach. So accept the outreach from people, even if you haven't talked to them in a little while, and reach out yourself to them, because we will get through this, but it has to be together.
Great words to live by. Doctor, thank you. Stay well, stay healthy, and thank you for all that you're doing for all of us. Really and truly grateful.
Thank you for all that you're doing for us too. Really appreciate it.
Asaf, Doctor, thank you so very much for joining us. Thank you for your dedication, your expertise, your service, and your willingness to continue to put the health of your community first in front of everything else. We are so grateful for it. And let's remember tonight, as we talked about it before, doing everything we possibly can to heed his warnings and his recommendations, and that of all of the other medical professionals, particularly for this week. Do everything we can to hunker down and to stay put. We each can make a contribution to getting us through this crisis quicker and safer, and we will be able to do so. I have no doubt that we're going to come through this as a stronger and fairer country, but it's going to take each and every one of us doing our part, particularly in these coming days. And if we can, reach out to those in need, because they're going to need that help and that support, particularly this week. Take care of each other, everybody, and stay safe.